Again, I am Dr. Mark Dailey. I am a doctor of chiropractic that specializes in the assessment and metabolic treatment of thyroid conditions. I'm here to tell you that there are some very powerful and proven ways to support the body metabolically that have changed the lives of thyroid sufferers all across the country. In this video and report, you'll discover the most common reasons why women get thyroid conditions, how to tell if you might have a thyroid condition, why some thyroid conditions are reversible, new advancements of the treatment of thyroid conditions, the different types of thyroid conditions and their associated symptoms, and new testing for thyroid disorders. Some 20 million Americans are affected by thyroid disorders. That's 1 in 13 people. And more than half of these people are unaware that they have a thyroid problem altogether because it frequently goes undiagnosed until it gets severe. According to the National Women's Health Information Center, 1 in 8 women will experience a thyroid disorder during their lifetime. After studying more about thyroid disorders, I realized really how poorly diagnosed and treated the conditions are. I also noticed a very disturbing trend in the current treatment approach for these conditions. But let's first talk a little bit about how the thyroid works. In healthy people, the thyroid makes just the right amount of 2 hormones, T3 and T4. These hormones have an important action throughout the whole body. Most importantly, they regulate many aspects of our metabolism, affecting how many calories we burn, how warm we feel, how much we weigh, and our general well-being. In short, the thyroid runs our metabolism. It's literally the gas pedal of the body. Now, thyroid hormones also have a direct effect on most organs, including the heart, which beats faster and harder under the influence of increased thyroid hormones. T3 is the more biologically active hormone. It's very important for cellular function. In fact, most T4, which is about 80%, is converted to T3 in the peripheral tissues of the body. So T4 is just a precursor, for the most part, to the more active T3 hormone. Now, one of the problems is that some thyroid disorders, you have trouble converting T4 to T3. Now, have you been checked for this? I seriously doubt it. Now, this itself can create a deficiency of T3, disrupting your body's ability to properly regulate metabolism, leading to many varied symptoms. Now, one of the controversial aspects of the most common thyroid medication, which is Synthroid, is that it's only T4. It's a synthetic T4. So if you have difficulty in your body converting T4 to T3, Synthroid is not going to be a very effective treatment. Now, before we go any further, let's cover 3 primary types of thyroid conditions. Number 1, hypothyroidism. Hyperthyroidism, or Graves' disease, and Hashimoto's thyroiditis, which is actually an autoimmune disease. Now, the symptoms of hypothyroidism, or slow thyroid, are fatigue, being tired and sluggish, having cold feet or hands, requiring excessive amounts of sleep to function, gaining weight easily or having difficulty losing weight, infrequent bowel movements, depression, lack of motivation, suffering from morning headaches that wear off as the day progresses. You may have thinning hair or excessive hair falling out, dryness of the skin or scalp, and mental sluggishness. Now, hypothyroidism is a condition in which the body lacks sufficient thyroid hormones. Since the main purpose of thyroid hormones is to run the body's metabolism, it's logical that people with this condition will have symptoms associated with a slow metabolism. Now, symptoms of hyperthyroidism, or Graves' disease, which is over-functioning of the thyroid, might be heart palpitations, inward trembling, increased pulse even at rest, nervousness or being overly emotional, insomnia, night sweats, difficulty gaining weight. Now, hyperthyroidism is the medical term to describe an overproduction of thyroid hormones. Although this condition is less common, it can precede a slowing down of the thyroid. It's usually easier to treat, however. Now, Hashimoto's thyroiditis. Hashimoto's is a condition in which the body's immune system actually attacks the thyroid gland. This is an autoimmune disorder. It's diagnosed by checking for thyroid antibodies, TPO and TGB, and gluten antibodies. Patients suffering from Hashimoto's thyroiditis will experience symptoms of hyperthyroidism and hypothyroidism, meaning they'll experience all or some of the symptoms above. Now, since the thyroid gland controls the body's metabolism, it can affect all the systems of the body, like the gut, the liver, the gallbladder, hormones, cholesterol, the brain via neurotransmitters, adrenal glands, breast tissue, ovaries, and the heart. And really, there are many possible causes for hypothyroid symptoms. As a matter of fact, you could have a perfectly healthy thyroid gland and still have all the associated symptoms of hypothyroidism. Now, what I'm about to tell you is extremely important. If your pituitary gland is sluggish, it will affect thyroid output, yet nothing's wrong with the thyroid gland. Remember, 60% of T4 is converted to T3 in the liver. So if you've got a sluggish liver, it can affect the thyroid gland. Yet the thyroid's producing properly. It's a conversion problem. 20% of T4 is converted to T3 in the gut. So if there's a problem in the gut, it could cause a conversion problem. And we look for this in our facility. T4 and T3 is transported to the conversion sites by a protein. There is also the possibility of a transport problem. We look for this. There are blood sugar dysregulations that will affect the thyroid output. Gut infections, leaky gut, parasites, inflammation all affect the conversion of T4 to T3. And 80% of all hypothyroidism is actually an autoimmune condition known as Hashimoto's. Again, that's where your immune system attacks your thyroid gland, and this needs to be treated as an immune disease. And there are specific protocols we use to bring relief to patients with Hashimoto's. This is why you can have normal lab findings and still suffer from all the above symptoms of hypothyroidism. See, we test all of these areas for signs of malfunction. We literally leave no stone unturned. That's what makes us different. That's why we help people that no one else has helped. Once we determine the cause of your thyroid problem, and there are usually many, we can then support your thyroid condition nutritionally, and you may not need medication at all. Now, don't get me wrong. I am not here to tell you to stop taking your current medications. Our office would never do that. We actually work with your medical doctor to get you feeling better as quickly as possible. Remember, no two thyroid patients are alike, so not all thyroid patients should be treated the same. Based on your personal blood chemistry, we can quickly determine the metabolic support that will benefit you most and get you started on the road to recovery. At this point, ask yourself a few questions. Number one, how has my thyroid condition affected my job, my relationships, my finances, my family, and other activities? What has it cost me in time and money and sleeplessness, happiness? And where do I picture myself in the next 1 to 3 years? See, if you have a thyroid problem that is not taken care of, what is it worth to you to improve your condition? Now imagine your life without thyroid symptoms. Think of feeling like yourself again and doing all the activities and things that you used to do. Here's what you do next. Call my office. Set up your evaluation. We'll send you some intake forms that will give us some real insight into your specific case. We'll ask you to forward whatever blood tests and records that you have that may be pertinent to your case. I will review these records before I ever see you. I will be completely familiar with your case. So to get started, the first step is simply call our office, 467-2500, and I truly look forward to the day that you are symptom-free.